Hi, I'm Logan. I'm doing my health assessment project, which is a complete physical examination of Donald. He's a 64-year-old male and he is Caucasian. His height is 5 foot 8 inches and he weighs 210 pounds. So I'm going to first put some hand sanitizer on and some gloves on just to keep the spread of germs at a minimum and practice safe hygiene practices. I just want to note that Donald agreed to this examination on him, and anybody who is in here in the house with him, he is okay with them being here while we do it. So first I'm just going to note his physical appearance. So Donald, your body's symmetrical, your face is symmetrical, each side of your face looks the same, there's no abnormalities in that. I don't see any visual deformities when I'm looking at you, and your posture is good. You're kind of sitting back in your chair a little bit relaxed. Also, I just have a couple questions for you, so if you wouldn't mind answering those. Can you tell me what we're doing right now?
I'm helping you with your project.
And can you tell me where we're at?
In my living room.
And can you tell me your name?
Donald.
And can you tell me who the President of the United States is?
Donald Trump.
Okay, thank you. And also, so that goes to show that Donald is alert and oriented ×4, so that helps us assess his mental status. Donald, how are you feeling today?
Good.
Good. So I just want to note that Donald said he's feeling good. His affect looks good. He's calm. He's cooperative. He's relaxed. Also, his skin color matches his ethnicity. And while we were conversing, his speech was very clear. It was even, and I could definitely tell what he was saying was understandable. Also, Donald's attire is matching. There's nothing abnormal about his attire. It's appropriate for the weather today, being inside and all. It matches, and he also looks like he keeps up with his hygiene, showers daily, he shaves daily, so he is keeping up with his daily living activities. And now we're going to assess his vital signs, and I'm just going to grab my stethoscope, blood pressure cuff, pulse ox, and temperature thermometer. Donald, can I ask you if you're having any pain today?
No pain.
No pain today? Okay. Alright, and then I'm just going to stick this pulse ox on your finger, if you don't mind. So that's going to measure your oxygen saturation. We want that to be between 95 and 100%. And we're just going to measure your pulse as well. Next, I'm going to take your thermometer. So this is a temporal thermometer. So I'm going to run across the top of your head, and it'll tell us what your temperature is, okay? Okay, 36.1 degrees Celsius, which is with normal limits. I'm going to set that right there. And then your pulse ox is 98% and pulse rate is 63. So those are both within normal limits as well. And now I'm just going to take your blood pressure real quick, if you don't mind. If I can use this one. Okay, and Donald's blood pressure is about 121/80, and his respirations are approximately 17 respirations per minute. Okay, Donald, now we're going to do your skin, hair, and nails assessment, so if you wouldn't mind scooting up in your chair and handing me an arm at a time. And I'm just going to inspect Donald's arm. He has appropriate hair distribution on his arms, his legs, he has bald on his head, but everywhere else he does have appropriate hair distribution. When I feel your arm, it's warm, but it is not moist, it's dry. All of your skin is intact, it's smooth. Going to take a look at your hands now. I don't see any lesions anywhere. Palms. And then your nails, I can see that they are appropriate contour, they're concave. There's no clubbing of the nails. There's no yellowing. If I just press on your finger to get your capillary refill. Capillary refill response is fast, it's good. I can see like around your knuckles is a little bit concave, probably maybe from a little bit of arthritis in your hands. I'm going to check this hand now. No lesions. Skin color is according to ethnicity. Capillary refill is quick. Again, a little bit of arthritis, but aside from that, I don't see anything abnormal. Your legs are the same. They're warm. They're dry. Skin is all intact. No abnormalities. And then if I check your toenails, capillary refill is fast in them as well. Your left large toe does have a little bit of an abnormality on the nail bed, but the rest are all normal. And while I am down here, I'm just going to check your pedal pulses as well. So that one is strong, A+2. That one is strong as well, so that'd be a +2. And then I'm going to check your tibial pulses. Okay, everything looks good. All pulses are +2. And now I'm going to go to your head. I'm just going to recognize that your face is symmetrical. And then if you don't mind, I'm going to palpate or just touch your head to make sure there's no abnormalities, okay?
Okay.
So I'll come to the side here. I'm going to look. Since Donald has no hair on his head, there's no chance of infestation occurring, so that's a plus. Is there pain anywhere when I push?
No.
No pain. I don't see any lesions. There's no swelling anywhere. So I'm just going to move down here, and then I'm going to put my fingers on your temporomandibular joint, and I'm going to ask that you open your mouth for me. Close it. Open and close. Okay, so by doing that, we're just checking that the cranial nerve is intact, and he did well with that. Next, I'm going to look at your ears and inspect them externally. I would inspect them internally, but I don't have an otoscope, or else I would be able to inspect the tympanic membrane in the ear, which I would expect to find it a pearly gray color if it was healthy and there was no infection or anything present. So now I'm just going to palpate the ear. I'm going to go up and down. You tell me if there's any pain or discomfort anywhere. I'm going to push on your tragus. There's no swelling, there's no redness, skin color is uniform. No swelling behind the ear either. I'll check the other ear as well. And no swelling on that ear either. Okay, so then I'm going to come in and do the eyes. I'm going to grab my pen light to do that. Okay, and I'm just going to look at the external part of the eye here because I don't have an ophthalmoscope, so I'm not able to use that to view the eye, but I will do everything that I'm able to. So I'm going to note that you do have eyebrows, you have eyelashes, the curvature of your eyelids are appropriate, and I'm going to use the pen light now. You'll just look at this finger, and I'm going to flash this light in your eye. And look at this finger. Okay, pupils were reactive. And now I'm going to ask that you look at this finger and you follow my pen light. And we'll do the 6 cardinal movements to... And then we're going to switch. Okay, very good. So that determines that Donald's eyes can adjust appropriately, and there's no involuntary movements while that's happening. So then we're going to stare at my finger again and follow it in towards your face. Okay? Okay, so that went well too. So Donald is able to, his eyes are able to focus and follow the finger into his nose. And then I'm just going to set my pen light down. So if you don't mind, I'm going to pull down your lower eyelids to look at your slit. Very good. No redness. It's pink. Looks healthy. There's no redness around your eyes at all. The parts of your eyes that are white, and there is no yellowing, so that's wonderful as well. Okay, and now we're going to move on to your nose. So the nose is symmetrical. Doesn't look tilted to one side or the other. And I will grab my pen light again. And I'm going to ask if I can just peek up in your nose a little bit. Okay, and then your septum is also midline with your face, so that's great too. I don't see any lesions in your nose, on your nose, or anywhere around your nose. And next we're going to do your mouth. So could you open your mouth as wide as possible for me? I'm just looking, I see your uvula there, it's midline, no abnormalities on your cheeks either. Your teeth are all intact. He does not wear dentures. He has all of his grown-up teeth there. And your tongue doesn't have any discoloration, no whiteness. Whiteness could be an indication of infection, so that's not present either. One more thing, we're just going to test one more cranial nerve here. If you could smile. That tests symmetry. If there was any drooping or anything, that could be indicative of a stroke, so we wouldn't want that to happen. And then if you can open your mouth and touch your tongue from side to side. Okay, so that's testing a cranial nerve. And do you have any trouble swallowing at all? Can you swallow? No? Okay, so that would also, if you did have trouble swallowing, that would be a cranial nerve issue too. Next we're going to go to the neck. Okay, and I'm just going to feel the lymph nodes on my way to the neck. So we have lymph nodes all around here and behind the ear. So I'm going to do that. I do want to make sure I don't put both fingers over the carotid at any time because that wouldn't be good. Okay, I don't feel any inflamed lymph nodes anywhere. And then I'm just going to bring it in and I'm going to inspect. See that your trachea, you can feel your trachea is midline. I don't feel any inflammation there. There's the thyroid, no inflammation. Upon palpation, it feels that it is of appropriate size. Okay, and then lastly, right now, for your upper body, we're going to do your range of motion. So if you wouldn't mind putting your arms out straight and holding them out for me and keeping them there just for a couple of seconds. Okay, go ahead and put them down. So doing that assures us that there was no stroke. Sometimes when people have a stroke, they'll have a droop and one arm will fall down while they're trying to keep their arms up. So now if you wouldn't mind putting your arms out here, maybe moving them around some, if you can touch, see, oh, very good. Okay, bringing them in front, back around, and down to the body, and back. Okay, good. You can put them down now. Okay, so Donald has full range of motion in his upper extremities. So if you wouldn't mind, just, can you put both of your legs up as well? Legs up and you can hold them up. Great. Go ahead and put them back down. Okay, so Donald appears to have full range of motion. Okay, so now we're going to assess your upper body, like your thorax and everything. So I'm watching you respirate and the chest expansion is equal on both sides. It's symmetrical and all of that. So now I'm just going to listen to your lung sounds, anterior, medially, and posteriorly. So if you wouldn't mind sitting up in your chair, that'd be great. Okay. We're going to start on the patient's right side. And take a deep breath in. And again. Again. Very good. I'm going to do one more on that side, but go through. Okay. Very good. And I'm going to stand up and I'm going to do the left side. Deep breath. Again. Okay, and I'm going to do again on that side, but up to your shirt, if you don't mind. Deep breath. And one more. Very good. Okay, and I'm going to come medially, and if you'll take a deep breath on that side. Again. Okay, and I'm going to do immediately on this side. Very good. Okay. Anteriorly and medially, all breath sounds were clear in all of the lobes that were assessed, and there was no wheezing, no crackling, or anything like that. Before I move to the back, I'm just going to auscultate the carotid arteries. First, I'm going to palpate them for a pulse, and then I'm going to auscultate them to make sure there are no bruits present. So remember, you only want to do one carotid at a time, so you don't shut blood flow off in both of those, since it carries me. Okay, left side is a +2. Right side is +2 as well, and then I'm just going to take a listen. And this side. Okay. I do not hear any bruits present. And then while I'm here on the chest, I'm just going to assess for skin turgor as well. So I'm just going to pinch your skin up a little bit, not my fingernails, just with the tips of my fingers, and make sure that your skin lays flat back down. Okay? Very good. Went right down immediately. Awesome. Okay, and now I'm just going to assess your breath sounds on your posterior side of your back. Okay? Okay, so we're just going to listen to your posterior breath sounds now, so if you would mind sitting up. I'm just going to pull your shirt up a bit in the back. And then we're going to start at the top of your back, work our way across, and then down until we hear them all. So can you give me a deep breath? Breath sounds were clear and all lobes assessed, and no wheezing or crackles. We're just going to go right then to your abdomen. We're going to, so if you wouldn't mind leaning back in your chair and move this. And I'm just going to roll your shirt a little bit. So upon inspection of the abdomen, there's no lesions anywhere. Everything is uniform. Symmetrical. The only thing is there is a scar from when he had his umbilical hernia repair. Aside from that, everything was good. There's equal hair distribution. I'm just going to take a listen to bowel sounds now. I'm going to start in the right lower quadrant. We're going to do that first, so we ensure we don't start palpating and then moving things around, and because we want to listen to the bowel sounds and get a baseline reading for that. So I'm going to start in the right lower quadrant and go clockwise. there are bowel sounds in all 4 quadrants. They're probably slightly hyperactive, if anything. And now I'm just going to start some light palpation around the abdomen. If anything hurts, let me know. Okay, and then we're going to start a little bit of a deeper palpation because that helps us feel the different organs in the abdomen more so. So if anything hurts or I put too much pressure, let me know. Okay, I don't feel any abnormalities, no bulges, no anything like that. The stomach shape is a little bit protuberant, but there's nothing abnormal that I can tell by my inspection and palpation. Okay, so I'm going to put your shirt down for you, and then if you sitting up again. Now we're going to do our examination of your heart. So if you wouldn't mind sitting on the edge of your chair for a minute. Just going to, first we're going to listen to the aorta. So we're going to go to the sternal notch here, and then we're going to go to the angle of Louis, and we're going to go down to the second intercostal space. I'm just going to stand up. Aorta sounds good, and then we're going to listen to your apical pulse. So that would be mid-clavicular line at the 5th intercostal space. So I'm going to lift your shirt up and go up that way. Okay. So 5th mid-clavicular, 5th intercostal. Apical pulse sounds good and strong, and if you wanted to get a full apical pulse for an assessment, you would listen to it for a minute straight, and then that would be your result. Okay, so next we're just going to go over some joints and muscles and that kind of thing. So if you could just put your arms out and flex your wrists back and forth, move them all around just to make sure you have mobility in those joints. And then your elbows in and out. Yep. Looks good, looks good. And then I'm just going, if you can just hold one arm out for right now. And then I'm going to push this way, and you're going to resist my pushing. Very good. Then I'm going to do it here, up here as well. Okay, other side. Okay, and this side. Very good. It didn't let me push you at all. Okay, and then we're just going to do your legs then too. So if you wouldn't mind, if you could put one leg out straight. And then I'm going to try and push your leg down, and I don't want you to let me. And then next. Very good. Okay. And then I think we touched on this earlier, but the leg hair distribution is good. The color is good. There's no edema anywhere that I can recognize. And then I just am going to ask that I'll give you my fingers, and if you can give them a good squeeze. Very good, very strong. Okay. All right, I believe that's everything. I'm just going to cover the male reproductive system. In short, it's important to give yourself a self-testicular examination periodically, and the best time to do that is after a warm shower. But I think that's everything. So, thank you.
Okay, thank you.